I've washed my hands. Hello, my name's Carissa. I'm going to be doing your head-to-toe assessment today.
Okay.
And do I have permission to perform the assessment?
Yes.
Okay. And can I get you to start by telling me what your name is?
Hey, Carissa, my name is Mark.
Okay, hi Mark. And where are we located at today?
We're in Nashville, Tennessee.
Okay. And what time of day is it?
It's the evening time.
Okay, good. So my patient is alert and oriented times 3. And next I'm going to go ahead and check your blood pressure. That's okay. Alright, just relax your arm here. Alright, you can relax this arm. Alright, and your blood pressure is 110/64. Is that normal for you?
Yes, ma'am.
Okay. Alright, and so with this assessment, I'm just going to be kind of looking over your body. I will have to listen to your heart and lungs and your abdomen as well. So when we get to that part, I'll kind of explain what I'm going to do there. So I'm just going to start with taking a look at your face. Looking at the symmetry of your face. Your skin color is brown and it's even on the face. Your eyebrows are symmetrical to your face. They are intact and full, as well as your eyelashes. Eyelashes are also symmetrical, intact, and full. Taking a look at your eyes a little bit closer, I do see that your sclera and corneas are both bilaterally symmetrical and clear. And I'm just going to pull down a little bit and check the conjunctiva of your eye, which is pink and moist bilaterally, which is good. And I'm just going to go ahead and use my pen light for a second to take a closer look. So just look straight at me. Right now I'm just checking the size of your pupils. So 4. And also a 4. So your pupil size is 4 bilaterally, which is good. And look straight at me. I'm going to check against the light. So I'm just going to check the reactivity. Look at me. Right, good. And look at me. Good. All right. And then look at my light. Okay, good. All right, so bilaterally the pupils are equal, round, reactive to light and accommodation, which is good. So next I'm going to take a look at your mucous membranes. If I can have you to open your mouth, and I'll take a look inside. All right, good. So the mucous membranes are pink and moist, which is normal. And also your lips are symmetrical to your face, which is good. Your gums are healthy and pink. That is good as well. I did not see any kind of lesions inside of your mucous membranes, which is good. So next, I'll just go ahead and check your trachea. All right, your trachea is midline, which is good. And I'm going to take a look at your ear, so just look straight ahead for me. All right. The ear shape is round. It is smooth to texture. It is brown. It is dry. And then taking a look at the inside, I do not see any drainage, and I don't see any lesions or deformities. Let me take a look at your other ear here. All right, it's also round, smooth, brown and dry. No lesions, no deformities, and no drainage from the inside of the ear. So your ears are equally, they're symmetrical and they're equally round, brown. There's no deformities, no lesions, no drainage from either of your ears, which is good. And so I'm going to go ahead and check your skin turd here and just pinch up some skin. All right. That is brisk, which is good. And I'm going to go ahead and now just look at your upper extremities. I'm going to check your overall skin condition. All right. So just checking this one. All right. So the upper extremities are bilaterally brown, smooth, dry, intact with no lesions, no excessive dryness, no bruising or vascularity noted. All right, and now let me go ahead and just check your radial pulses. Here. All right, and your radial pulses are 4+ bilaterally, which is good. Also, I'm going to take a look at your fingernails on both hands here. All right, and so the fingernails are smooth, they're flat and rounded in shape bilaterally with no clubbing noted bilaterally. And then let's check your capillary refill here. All right, and the capillary refill is less than 3 seconds bilaterally on the upper extremities. Next, I'm going to go ahead and move to the lower extremities and check the overall skin appearance here too. Just show you just feeling. All right, so bilaterally, the lower extremities are brown in skin tone, smooth, dry, and intact with no lesions, no deformity, no excessive dryness or vascularity noted there. Now I'm going to go ahead and check your dorsalis pedis pulses while I'm here. All right, dorsalis pedis pulses are 4+. Next, I'm just going to, you can relax. Just going to check for tibial edema here. Pressing for 5 seconds. No tibial edema noted, which is good. And I'm going to go ahead and check capillary refill in the toenails. All right, less than 3 seconds. And can I have you to press as hard as you can up against my hands with your feet? All right, good job. Okay, and let me wash my hands. All right, so bilaterally the dorsalis pedis pulses were 4+, which is good. Your capillary refill was less than 3 seconds bilaterally in your toenails, which is good as well. And plantar flexion was graded at a 5+ bilaterally, which is good for the strength in your lower extremities. All right, so next I'm going to go ahead and palpate your carotid arteries separately. All right, and carotid arteries are bilaterally at a 4+, which is very good. And so next I'm going to go ahead and do your lung sounds, listen to your lungs. If I could have you to take your shirt off,
Okay.
that'll be easier. All right, and are you comfortable leaving your shirt off, or do you want a blanket to cover?
No, I'm fine.
Okay. So before I actually listen, I'm going to just check your anterior posterior size up against your transverse size. All right, so AP is less than transverse, which is good. And so next I'm going to go ahead and listen to your lung sounds. I'm going to be listening to 8 places on the front and then 10 on the back, or 8 to 10 on the back. So when you feel my diaphragm, just take a deep breath, and I'll probably still ask you to take a deep breath as well. Deep breath. Okay. Good. Okay, good. So anteriorly, lung sounds were heard. They were clear to auscultation. They were vesicular sounds, were the predominant sounds that I heard. I did not hear any adventitious lung sounds, and I didn't hear any rales or rhonchi or any wheezing anteriorly, which is good. So if I could ask you to turn around, I'll go ahead and listen to the posterior lung sound. You can do that blood pressure, because I'll move it. Alright, so it'll be the same process back here. Just when you feel my diaphragm, just take a deep breath for me. Deep breath. like I'll do one on the side here, deep breath. Okay. So the posterior and lateral breath sounds were vesicular in sound. I did not hear any adventitious lung sounds there as well. Didn't hear any kind of wheezing or rhonchi or rails, so that was good. Alright, so next I'm going to, I'll have you to, well, let me go ahead and get this before I have you lay down. Grab my hands and I'm going to check the grip strength in your hands. Just squeeze. Okay, good. So grip strength is +5 bilaterally. That's good. So I'm going to go ahead and have you lay down here. Alright, and I'm just going to take a look and have you take a really deep breath in and out for me. Okay, very good. So in the pericardium, you don't have any lifts or heaves. It is even chest rise and fall, which is good. And I'm going to take a look at your abdomen. So just looking over your abdomen, it's smooth, it's not distended. Your umbilicus is midline. I don't see any drainage coming out of there. And also I don't see any peristalsis in the abdomen, which is good as well. And I'm going to go ahead and listen to your abdomen for bowel sounds. So your bowel sounds were normal active to all 4 quadrants, which is good. And I'm going to go ahead and do the palpation part of it. So I'm going to start with light palpation, and I'll go over each quadrant, and you just tell me if you feel any pain or tenderness, and I'll ask.
Okay.
Do you feel pain or tenderness?
No.
Okay. Pain or tenderness?
No.
Pain or tenderness?
No.
Pain or tenderness?
No.
Okay. So I'm going to just go a little bit deeper now.
Okay.
Pain or tenderness?
No.
Pain or tenderness?
No.
Pain or tenderness?
No.
Pain or tenderness?
No.
Okay. So no pain or tenderness to all 4 quadrants, and that's with light and deep palpation, which is good. And next, I'm going to go ahead and listen to your heart sounds.
Okay.
I do have to do this 2 different times,
Okay.
so it'll feel kind of repetitive. But if I could just get you to just relax straight down here.
Okay.
Right? And I'll go ahead and I'm going to state where I'm listening as I'm listening.
Great.
So we're going to start with your apical, which is at the 2nd intercostal space, and this is going to be at your right sternal border. And then we're going to move to pulmonic, which is also at the 2nd intercostal space, and this is at your left sternal border. Alright, moving to the 3rd intercostal space at the left sternal border. This is your herbs point. Moving to your 4th intercostal space at the left sternal border. This is your tricuspid. Alright, and then moving to the 5th intercostal space at the midclavicular line. This is going to be your your mitral. And I'm going to go ahead and take your apical pulse. So I'm going to listen to your heart for 1 minute. Alright. And that's going to be 60 for your apical pulse. I'm going to listen one more time.
Okay.
with the bell of my stethoscope. Alright. So we're going back to the mitral, which is at the, or I'm going to start back at the apical, which is your second intercostal space. And this is at your right sternal border. Right, then we're moving to pulmonic, which is also at the second intercostal space, and this is at your left sternal border. We're going to move to herbs, which is at the third intercostal space, left sternal border. I'm going to move to tricuspid, which is at the fourth intercostal space, left sternal border. And then into the mitral again, which is at the fifth intercostal space, mid-clavicular line. Alright, so when I listened with my diaphragm and my bell, I heard your normal heart sound. So I heard an S1 and an S2. I didn't hear any extra heart sounds. I didn't hear any murmurs. So your heart sound sounded good there. Your apical pulse was at 60, which is good. So we're all good there. And I'm going to have you stand up for me now, if you will. Alright, so now I'm just going to be checking your spine out. So just looking at your spine, this way. Looking at your spine, I do not see any kyphosis, lordosis, or scoliosis in the spine. So I'm just going to kind of palpate down, and you tell me if you feel any pain. Feel any pain?
No.
Okay. And can I ask you just to bend straight down? And I'll just kind of check. Okay, good. You can stand up. So I don't see any abnormal curvature in your spine. I did not see any lordosis, kyphosis, or scoliosis in your spine. So that is normal as well. Alright, and I can have you have a seat here. Alright, and do you have any questions for me?
No.
Okay, this concludes your head to toe exam. And I hope that you have a good rest of the day.
Thank you.
And I'm going to wash my hands again.